A clear legislative rebuke to the troubled health care law today. The Republican-controlled House passed a bill aimed at undermining the Affordable Care Act, voting to let insurance companies renew canceled plans and sell individual health plans to anyone, even if they don't meet coverage requirements in the new law. 39 Democrats broke ranks supporting the so-called Keep Your Health Plan Act. The bill now goes to the Democratic-led Senate, where it is expected to fail.
And, of course, all of this comes as President Obama met with top healthcare insurance CEOs today at the White House, trying to drum up support for his latest fix to the troubled law. He urged those companies to reinstate thousands of policies that were canceled, and he enlisted their help to get the problem-plagued healthcare.gov website back on track as well. The president spoke before the meeting about the need to reach out to those executives.
I appreciate all these folks coming in. We're going to be soliciting ideas from them. There's going to be a collaborative process. We want to make sure that we get this done so that in the years to come, every American is going to have the kind of affordable health care that they all deserve.
Well, John Harwood joins us once again from Washington tonight. Of course, we'd all love to know what was said in that meeting after the president spoke. But really, John, what happens next at this point?
Well, the most important thing that happens next is the effort between now and November 30th of the administration to meet its pledge to get that website functioning smoothly. They've reported some progress so far, and it was interesting that in the outset of the meeting, including that bite that you just played, Bill, the president made clear his agenda for the meeting wasn't just about that fix, which may be of dubious impact in the long run. We don't know how many people will be affected by that. But enlisting those executives to help work around where necessary the problems with the website, communicate with customers, get people signed up. Because the thing that's ultimately going to determine the success or failure of this law is whether they can get a critical mass of people to sign up under the exchanges, under the new pricing structure that has left the old one behind, which is why you're not going to see that many policies get extended into 2015. If they can get that working, get people to see the choices that they have, then the law's got a shot to succeed.
John, you mentioned that November 30th deadline. I don't know if that's still going to stick. Maybe you don't know either. But there have been so many deadlines, and they keep changing. Which are realistic that they're going to stick, and which ones won't?
Well, the reason that November 30th is so important is that in order for people to be covered on January 1, and there are a lot of policies that expire at the end of 2013, you've got to be able to sign up by December the 15th and pay a premium. November 30th gives you 2 weeks after that for that to happen. Now, the pattern that we've seen and every company sees when they have open enrollment is it tends to come in a flood at the end. So if it's not right at the end, you're going to have real problems heading into January. Beyond that, you've got a deadline of March 31st. That's the end of the open enrollment period. That's the last point at which people can sign up and be deemed to be covered under the individual mandate.
How much you want to bet those deadlines change again next week, and you'll be telling us all about it. Thanks so much, John. John Harwood reporting from Washington.